whenever you're ready. Hello, everybody, and welcome to the Indiana Daisy Coordinator Roundtable. I'm Janet Silvestri, Senior Program Director for the Midwest region, and I'll introduce our Daisy co-founder, Bonnie Barnes, in a moment. But first, I would like my Daisy team, who is here to assist with our roundtable, to introduce themselves. So we'll take who's first on the screen here, Rebecca.
Hi, good morning. Thank you so much. My name is Rebecca Blay, and I'm a regional program director here at the Daisy Foundation over the central part of the U.S.
Thank you so much. London?
Good morning, everyone. My name is London Sims. I am the program manager here at Daisy for the Northeast region. Happy to be here with you all.
Thank you, London. I can't tell if Vernita is on the call. Vernita, are you with us?
Yes, I am right here. Hello, hello, everyone. My name is Vernita Boswell, and I am the Regional Program Manager for the South region.
Thank you, Vernita. Chelsea.
Hello, everyone. I am Chelsea Moise, Senior Program Director, apologies for the dog, of the North Mountain Northwest area.
Thank you so much. Jennifer?
Hi, I'm Jennifer Condi, and I am the program manager for the Mid-Atlantic region.
Thank you, Jennifer. Kate?
Good morning, all. I am Kate Annenson, Program Specialist for the North Mountain, South Central, and West region. Happy to be here with you.
Thank you, Kate. Alex?
Hi, everyone. My name is Alex Schoen. I am a Senior Program Director at the Daisy Foundation, serving our international partners and our supportive associations. So it's lovely to be here, and I'm looking forward to speaking with you all.
Thank you so much. Nicole?
Hi, everybody. Good morning. Happy October. My name is Nicole Dodson. I'm the program manager here for the West Coast, Best Coast region. So I oversee Hawaii, Alaska, and California.
Thank you, Nicole. And Jackie?
Hi, I'm Jackie Park. I'm the IT manager here at Daisy. I'm going to be running everything behind the scenes today, and I'm sorry for the technical difficulties I'm having with my video. So I'm going to try to fix that as well.
No worries. Thank you so much. Is Melissa on the call today or Deb?
I don't think so.
Okay, I didn't think they were going to be joining us. But thank you all for introducing yourselves. We've already hosted many roundtables around the country, and we've had a great response from our Daisy partners. These sessions not only give you an opportunity to network with other Daisy coordinators in your own state, but you'll also get some great ideas from the presentations and the breakout room sessions. So before we review the agenda, it is my sincere honor to introduce our Daisy co-founder, Bonnie Barnes, to welcome you all to our session today. Welcome, Bonnie.
Well, thank you, Janet, and thank you all for taking the time to share with us what's going on in Indiana and to share with each other best practices. Oh, you can tell our dog just decided to oh. Hold on one second. Just quiet. Someone just her, and needless to say, the timing is just perfect. We'll go bark at the other end of the house. Anyway, as you can tell, and we've had organizations in Indiana that we've been partnering with for many, many years, but you can tell the Daisy Foundation has really grown by the number of our team members that are on the call with us today. We could not be more proud of this program team that has really embraced how to honor nurses, how to take the Daisy Award and bring it to life and make it the best it can be for all of you. We are now partnering with over 6,700 healthcare facilities in 41 countries. So we couldn't be more delighted to be able to share all we have learned and to welcome all of you to what I hope will be a very special time for you. Now I'm going to go on mute so you don't have to hear Schultz in the background, and neither do I. Bye, everyone. Have a great meeting.
Thank you so much, Bonnie. So I'd like to review the agenda and go over a few housekeeping notes. You are free to chat with each other and with us using the chat function in Zoom. If you have a specific question, make sure to include your email address in case we need to follow up with you after our event. Please stay muted during the presentations and unmute while participating in the breakout room sessions. We are recording this event only while we're in the main room. So if you don't want to be recorded on camera, you can choose to turn your camera off while you're in the main room. But we hope that you'll put it back on during the breakout sessions that will not be recorded so that everybody can see and hear one another during the breakout discussions. It's not going, hold on. I'm not sure what happened here. We broke out into 2 pages. My apologies. We have structured 4 breakout rooms for you to choose from. And when we get to that section, I will pull these back up so you know which one you want to select. And we have them specifically for large facilities, small facilities, non-traditional specialty programs, and newly committed or first-year programs. So you can decide what discussions you would like to be part of. Not quite sure what happened with my slide, but it's all there. So we'll put this back up when it's time to go into the breakout rooms. So after we have our presentations, you will click on the breakout room instruction. You'll pick which room you want to go to. And then when it's time to leave and go back to the main room, you'll just click the blue leave the breakout room session. So it'll take you back to the main room. Okay, so now I would like to introduce my co-host this morning. Mallory Luby is with Ascension Indianapolis, and she's going to introduce our speakers as we go through our event today. So Mallory, thank you for being here.
Thanks, Janet. Hi, everyone. I'm Mallory Luby. I work for Ascension St. Vincent in Indianapolis. I'm really excited and happy and honored to be here. And I just have the privilege to introduce 3 of our speakers. We will go ahead and start with Chris Butler, who is from Adams Memorial. So Chris, take it away.
Good afternoon. I'm going to share my slides here. Sharing's not turned on, it's telling me. Jackie. Here we go.
Try it again.
Yep. Can you see me? Can you see my slides?
I think we're good, Chris.
Awesome. Okay. Good afternoon, and thanks for having me. I'm here with my CNO, Jennifer Helt, and we kind of work on all of these things together. But we just are really pleased to be invited and included with this organization and to be able to bring this kind of recognition to our team. So thanks for having us today. We work at Adams Health Network. We're located in Decatur, Indiana, Adams County, Indiana. We're rural, critical access hospital. We're licensed for 26 beds. We can house up to about 32 patients. We are a county-owned hospital. We have a med-surg, ICU, OB unit. The county EMS is housed here. We have an outpatient behavioral health unit. We have a swing bed program. Our hospital is 101 years old. And our network also includes physician offices. We have 33 employed providers. We have a network of APPs and PAs, and we've also got 2 senior living facilities on either end of the county. And then one of the more interesting things about our county is that 1/3 of our about 35,000 population are Amish. So we began DAISY, we're probably the newest of the group, in 2021, right in the midst of COVID. And what was kind of nice for us was this was the first event that we had done, that we had invited outsiders really into the hospital because we had just lifted some of the visiting restrictions. So we decided to try and celebrate DAISY. We wanted to try and do it quarterly. We chose to include since we're a small organization and we all work very closely together and we share a community of the same patients, we do not make the distinction about hospital versus our office nurses versus our nurses, our colleagues in senior living. We all take care of the same people. So we have included them in our DAISY program, which might be a little bit different than some organizations. So what we did is we stationed DAISY boxes everywhere. And Adam's already had a history of collecting small, "You're awesome" little statements from patients in all aspects of the network. So there was already a history of that. And there was a little bit of confusion at first once we put the DAISY pieces out there, but the DAISY boxes went up everywhere: senior living, the offices, the buildings, all of our departments. And we started to include DAISY nominations in all of our folders and discharge packets. And we share the link to our DAISY information in our print media and on our social media. So most of our nominations are received while our patients are still in the hospital through the DAISY boxes, but more frequently we are getting some through the intranet based on our link on our website. And we've decided that we accept nominations from patients, family members, and also from coworkers. And the only consideration we make there is that it needs to be a nomination that talks about the compassionate care provided to the patient, and not just about, wow, this person, this nurse is just so great and so awesome and my buddy at work. Nothing like that. It really has to be something that is heartfelt and shows the dedication to the patient care and attention to detail that we expect here. And some of our first nominations were from providers and from coworkers. So we do consider them. We review all nominations quarterly, and we hold off voting until we have about 8 to 10 nominations. And that's gotten easier as we have done this a little bit longer. So our DAISY selection team is created of a multidisciplinary team of RNs from the hospital, from senior living, from the offices. We also include our marketing professionals, and we tried not to include the direct patient care managers because we didn't want to put them in a situation where they could figure out easily, because we're so small, who we're talking about. So we try to make it as non-biased as we can. So we put together a PowerPoint presentation of the nominations. We vet them through HR to make sure that there are no issues. There's no reason why we should not present this award. We always send them to our CEO because, again, we're so small. He likes to see the nominations, and I think it's become just a point of pride, and it's kind of nice that he gets to see all the good things that people say about our staff. The nominations are blinded, so when we have our meeting, we hand out ballots and we go through the presentation. People are allowed to take notes, but secret ballot, they write down their ballot, we hand them in, they're all counted. I don't vote. If we ever have a tie, then our CEO, Dr. Smith, is the tiebreaker. We have never had a tie. So when we plan the ceremony, each person on our committee has a role. And I think it takes all of us because there's so many little details. So what we do is we split up the work, and there's one person who, she knows everyone in town, so she's the one who notifies the families. We have someone else who, usually someone who works with the honoree, so we get them to notify the coworkers. We notify the patient that nominated the person, if it's a patient, and we invite them to come and tell their story. And then we have to carefully invite all of our team members with that is going to be. Initially, we did all of these in hallway when we first started, because again, we were still in the midst of COVID and we didn't allow a lot of outsiders into the hospital. We had just started allowing one visitor in per patient. But eventually we moved to the main lobby, and then as things progressed, we actually have started to take DAISY on the road to visit our honorees where they work. We invite our local press, we invite our board members, we invite all of our previous DAISY honorees. And one of the nicest things for us, and the thing that's made it so special for us, is we include Janet and Bonnie anytime they're available. They help us tell the story about the DAISY organization, and it makes such a difference to all of our nominees and to their families and to our honorees. So we're extremely fortunate. On ceremony day, we always try for a surprise. So usually it's a fake meeting or a luncheon meeting, or someone's called in to do an interview, something like that, because we want to try and keep it a surprise. One of the best improvements we've made in our ceremony is initially I did most all of the talking, and as you can tell by this point in the slides, you're done with me. I asked Janet for feedback, and she said that there were some places who just shared parts of the ceremony with other people on the team. And once we did that, I really feel like our DAISY presentation really started to hit all the right notes. So these same people who did all the legwork with me to get everything ready then took a part of the ceremony and really put themselves into it to try and learn more and be as eloquent as they can be about the statue and about the all of the benefits of being part of the DAISY organization. So when we do this, everyone presents as a team. We have it videotaped so that we can give this to our honoree and they can watch it or share it with their family. We present the award, the statue, the gift bag, dozens of daisies. You'll notice some of the pictures of our nominees and honorees. We make them wear the daisy headband, which is kind of one of our little trademarks. And we do a banner for each nominee. We start signing it before, as we're setting up. And then they keep it on their unit and their other coworkers sign it. And I think that's meant a lot. So they each have their own DAISY banner to keep. And our chef, who found out we were going to try and buy commercially made cinnamon rolls, was just outraged and insisted that she make her own. And she makes us wonderful cinnamon rolls, about 36 at a clip, so that we can share plenty with the honoree, her work team, her family, the patient who nominated, anyone who is there. We encourage our patients to share their story about the winners or the honorees, and they're not always comfortable doing so. So sometimes they'll still come to the ceremony, but they want someone else to read it. And then Dr. Smith, the CEO, and I write a separate special card to the honoree. Things that I think we do well is we work really, really hard to keep this a secret. And most of the time we do pretty well. We provide the managers with nominations information for all those who are nominated. And one of the suggestions that came from one of our managers was she took any of the DAISY nominations for someone who did not get the award. And we provided them with DAISY cards, and they had their entire team sign the cards, write something to the nominee. And then at the next unit meeting, they presented the nominee with the pin and the card in front of their coworkers, which I think really gave it a lot more meaning and made it special for every single nominee, as it should be for this type of recognition. So I think we do that, and it's made things even more special. We have shared parts of our award. I think that was a game changer for us, and I'll be forever grateful to Janet Silvestri for that suggestion. We have also included travelers in our awards, and the reason was we were very travel dependent early on in COVID, and we had people that stayed with us and traveled with us, some for 2 years, and they gave some outstanding nursing care. And for us, we felt it doesn't really matter that they don't work for Adams forever. We felt that they took care of our patients as though they did. So we awarded 2 of our DAISY awards to travel nurses. And I think we've tried to be flexible. We've included actually physicians who have wanted to be part of our ceremony. We've let them participate with us, though it's traditionally a nurse award, but those that have asked, we've included them. And as I said, we've taken it on the road to one of the offices for a nurse who could not, there was no way we could get her to us without exposing the secret. So we've taken it on the road, and that actually turned out to be a lot of fun. So that's all I have. I put my email here at the bottom. If you have any questions, comments, whatever, please be happy to hear from you. Thank you.
Awesome job, Chris. Thank you so much. I'm surprised you didn't wear that daisy headband the whole time you were presenting, just to keep things interesting.
If they knew, they would have made me.
maybe next time for sure. Do we have any questions for Chris? We'll just open the floor for a couple minutes. Come off mute.
I've got a quick question. This is Monica. I'm calling from the Indianapolis VA. When you guys, about how many nominations, first of all, do you guys get a quarter? Because you guys do it quarterly, is that correct?
Yes. Serious nominations, we want to have at least 8 to 10. Overall, we end up now with about 16.
Okay. Okay. And do you guys, so you guys take staff to staff nominations and you count them as well. And when you do that, do you find, I mean, what is is that about half of what you get of nominations or just a few, or do you occasionally get them?
For us, they're occasionally, and they're extremely patient focused. Once was about a staff member whose family was the patient member. Their mom was having surgery, and it was all about the care that they received from the pre and post-op nurse. And another time it was a physician who worked side by side with our ED manager. And so they had been through some particularly difficult situations and during COVID. And so it was a very long nomination, but those were really the two that we awarded that were employee-based.
Okay. Thank you.
You're welcome.
Any other questions for Chris? Okay, we will continue and move on with our next speaker and presenter. So Leanne is from Monroe in Bloomington. So she will share her screen and get going.
Okay, there we go. Can you see my screen? Okay, all right. Thank you so much. I appreciated being a part of the DAISY presentation. The DAISY Award is really something special here that our staff really look forward to. We're in Bloomington, Indiana. We are a small 32 bed acute care hospital. We have 24 med surg beds, 4 progressive care, 4 ICU beds, a 12-bed emergency department. And like I said, we're located in Bloomington, Indiana, and we have around 100 nurses that work at our hospital. So how we nominated our nurses, we started presenting DAISY Awards in 2016. And now we have changed, we're doing that once a year now. We give 2 DAISY Awards. The first time we did it, we just gave a bedside DAISY Award, but now we're doing a bedside nurse and leadership. And in our leadership, we include our charge nurses, not just the directors of the departments, because we are small. So we include also our charge nurses and house supervisors into the leadership roles as well. We receive nominations throughout the entire year. And there's a few different ways that people can submit those nominations. We do have QR codes available for staff. I attached a copy of what we send out. It's also, the QR codes are available on the hospital intranet page, so they can get there that way. We have before at different times put little tent cards on the patient meal trays just once a day for lunch, and we'll put the QR code on those little tents as well that go into all the patient rooms, so that makes that easy for them to nominate their nurse. And then they're also on the hospital website itself. And then we have the trifold nomination forms that are in each one of the nursing departments. There's actually some in our hospital cafeteria too, and in our front lobby. And then, like I said, they're also on our hospital website and our intranet page. I send this out in addition to what's on the trifold. I usually email this to all the staff, and we also have it posted in the nursing areas. So I want people to really understand, because we do take nominations from staff for their coworkers. And then of course for the leadership, that's staff driven as well. For the Leadership Nursing Award, primarily staff driven. So I really want them to understand what the nomination needs to entail. We want them to focus on what's right for the bedside nurse, why they became a nurse. Remember your why, and try to come up with a story or something, because a lot of times the coworkers will see what the nurse did, and maybe it's an elderly patient. They can't necessarily nominate. They're just not in the condition where they can do that, but somebody saw them do something pretty special and pretty amazing, and have that. One year, one of our that stands out to me, we had an ER nurse, and this was during COVID too. We all have so many COVID stories, but we had an ER nurse bring a patient down to our progressive care, and she noticed that the nurses were all very, very busy. There was one patient that was in COVID isolation, hadn't had because the nurses were so busy, that patient hadn't had all the hygiene and all the just little special TLC that you want to give your patient and make their experience the best it could be, especially during that time when we didn't have visitors. And so she went down. The ER wasn't especially busy, so she came back, put that patient in the shower, gave her a shower, changed her bed, and got her drinks, and just kept her company for a while, and just really went above and beyond. And I always like that story because it was easy for her to walk away and go back to her department and not notice that, but she made it an effort to come back and do that. And so that was one of our winners one year, and I really like that. And then the nursing leader criteria, we want them to be somebody who's an advocate for their team, who is a compassionate leader, and displays all the things that are important about being a nurse. So, and we don't, like I said, we're a small hospital. We don't have a lot, but we've had a lot of diversity in the nominations for this award. It hasn't been the same one over and over. So that's worked out really well for us. So our DAISY honorees, like we said, we have ballot boxes throughout the nursing units in the front lobby. I usually send out a message and let everybody know. It's also on the trifold form that they could give that nomination. We have little DAISY boxes all over that the staff had covered with DAISY material. It's really cute. So they could put their nominations in those boxes. They can just give it to their director, or they can just give it to me. We all know each other well here, so it's easy, and we're easily accessible to each other. I also make sure that the staff know when they get a DAISY Award honoree, what that means and what they're going to receive. So we tell them about the DAISY nurse certificate that's in the portfolio, about the special designated DAISY pin that they get, and then about the Healer's Touch sculpture that they get. And the one for the bedside nurse is a little bit different than the one for the leadership that you can see pretty well in this picture. So how we select our winners, we get a group of staff members that are chosen to participate, and can be anybody. It's not just nurses. It's people from all other departments. We've had unit coordinators on there. We've had respiratory therapists. We've just had choose a hodgepodge of people to participate in that process. The nominations are all blinded, and we assign each story a number. We go through each nomination and read those aloud to the group, and we always encourage them to take notes along the way. And then after the stories have been read to everyone, then the group just votes on the number that they want, and then we will tally those up and see who the honoree is going to be, but we do not announce that until the actual celebration. And then after the honoree receives their award, then we will announce all that to the staff via email. We have the hospital newsletter that goes out quarterly, and then we also post that on social media, mainly Facebook and LinkedIn. And then we also call the family members and ask them to attend. Like, we're a small, tight community, so we usually know somehow how to get a hold of each other's families. So we're able to do that and include them so they can come, and that makes it extra special. These are the awards that we just did last year, and this is this is the email that we sent out, and also what we published on Facebook and on LinkedIn. We do ours just once a year. We make it a huge deal. It's during hospital week. We also do a non-clinical, a non-nursing award during that time as well, for a clinical and non-clinical person. So there's usually 4 awards at least that we do during hospital week. But since we just do it once a week, once a year, we try to make it very, very special. We make it a big deal, and make it a big celebration, and have it in our hospital cafeteria, and invite as many people as we can get there. The whole hospital is invited. So here's just another picture of another celebration that we had. And like I said, the awards are presented during hospital week. It's a hospital-wide celebration. There's usually things going on all week, but the Daisy Award, everybody always looks forward to that day. When we do the celebration, we begin by reading the significance of the Daisy Award, what it represents, and how it came into existence, so people know how special that is and the meaning behind it. I think that's important. They're recognized, they're given a certificate and a pen and the sculpture. And of course, we have the Cinnabon cinnamon rolls that we always serve warm. And sometimes we have even more food. So we have a very talented administrative assistant here. And so last year she made these absolutely gorgeous little cups for us as well. We usually have a big spread, so it's a lot of sweet food. So that was what we had in our spread last year, was these cute little cupcakes in addition to the cinnamon rolls. And that's the other pictures just showing the table full of balloons and flowers, and it's just a great time for all of us. And the way we continue to honor our Daisy Award winners throughout the year is we have this plaque. It's in the main hallway of our hospital. So we have the winners from the first year that we started, and we have the name of the bedside nurse and the name of the leadership nurse who was chosen for that year. And that is the end of my slides. Thank you.
Thanks, Leanne. Any questions for her as we wrap up our smaller hospital? I always love to see how things are done so differently based off of the size. So super cool. Any questions for her?
I have a question. This is Monica again. So same question. Being a smaller hospital, about how many nominations do you get a year?
We have quite a few. The leadership ones, not as much because there's not as many of them. But I think last year we had probably 20 to 25 nominations for Daisy. And I had probably 8 or 9 for leadership.
And of those 20 to 25, about how many are staff to staff? Do you know?
How many are nominated by staff?
Yeah.
I'd say a little over half. Our winner last year was nominated by patients, though. Actually, sometimes, and I've seen this in the past, we'll have one nurse that receives many nominations. So our bedside Daisy Award winner from last year, he received 5 nominations alone from patients. So I think that speaks volumes when you have patients nominating the same nurse over and over and over again.
Yeah, I agree. We have a similar thing at our facility at the Indianapolis VA, where we have several staff members that have been nominated repeatedly, and that's why we've gone to the multi-pin. I don't know if you've seen that, instead of giving them individual pins, because we award out pins with each nomination. And so we've started going to this to a pin where they can get like up to 10 nominations. They get the green pin with 5 daisies on it. And then there's a platinum or something like that that has 5 daisies on it as well, for like an infinity pin. But we have that same thing at our VA as well.
Yeah, we try to recognize our nominees as well, not just the honorees when we're in that, when we do our celebration and then we announce who the honoree is. But at that same time, like I said, we try to make it a big deal and make it special. And so we do try to recognize all the nominees. Everybody who was nominated is presented with the certificate and with the daisy pin. but it does seem like some of the same nurses get nominated over and over again.
Thank you.
You're welcome.
Anyone else? Any other questions?
There is a question in the chat. What's the due date for having the results and pictures of our fall winners for the IU PowerPoint?
Does anyone have an answer for that?
I'm not sure what that is referring to.
I wonder if it's the IU School of Nursing. I don't know if that's a IU School of Nursing specific question.
Yeah, I'm not sure. It sounds like an internal question.
Okay, we'll get it contacted.
Okay.
All right, so we will keep moving on to our specialty hospitals. We've got unique DAISY programs throughout the state, but I'm going to give it over to Laura, who is going to share how Riley Children's Hospital in Indy handles their DAISY program.
Yes, hopefully I get the sharing right. Let's see, it worked yesterday, so we got that going for us. Okay, can you see it yet? Okay, and I'm gonna try to get into presenter mode real quick so you can see I'm big. Okay, hopefully that worked. So hello everyone, my name is Laura Koch. I'm the program manager for nursing at Riley Children's Health. I'm co-presenting my colleague Kristen Miller. We actually have our innovation day and it actually happens to be from 12 to 2. So we're tag teaming a little bit here so that we can be in both places, but she sends her well wishes and we are co-presenting today. So I am from Riley Children's. I have a little picture of our main tower. So we are actually, let me move you guys over really. We are a 456 bed maternity and children's hospital. We actually have 2 main campuses. So we have our downtown Indy. We also are located in Carmel. We have a NICU and a Peds PICU there as well. Like I said, we are also actually a maternity facility. So about 2 years ago, almost 3, we opened our maternity tower. So feel really blessed and fortunate to also have moms and babies in our facilities as well as young adults. We are a 5-time magnet hospital and we are a part of IU Health. So we're part of a larger system. We partnered with DAISY actually in 2008. And I have a little bit more kind of about that history here. So when we started, we did quarterly honorees. And then in 2017, we actually switched to monthly based off of the volume of nominations we were getting. We felt like it was time to switch to have more winner or honorees every year. We also, I'll share more later in our slides, but we also have DAISY Leader and DAISY Team Awards that we do during hospital week. But the monthly winners we do are DAISY winners. So this is a picture of our wall plaques. This hangs in our main Simon Family Tower lobby. So we wanted to send pictures of those plaques. Next to that, we'll have ways patients and team members can nominate. Similar to my other colleagues, we do accept nominations from patients, families, and team members. And some of our spaces, for example, I had a recent conversation with one of our OR managers. They said, I have a really, really great story. I'd like to nominate my colleague because a lot of those nurses give exceptional care, but they don't actually have interfacing with the patients while they're awake. So they maybe don't know their name. So I do recommend that managers or team members also nominate. I think just like some of my colleagues, it's just sharing the story and making sure you're outlining. And some of our most beautiful nominations come from that avenue. So this is our nominating committee. We actually have a Nursing Excellence Council that is, this is a small day. I think we were during summer breaks, but we have a nurse from every unit come and join us every month. So that's one reason we really liked that the DAISY program live with this group. So again, it's kind of nurses voting for nurses by nurses. They actually have really helped this year. I'm excited to share some of the things that we've updated. So part of our council is myself as the program manager. We have 2 nurse directors, 2 managers, many of frontline nurses or clinical nurses. And then I would be remiss, we have 2 amazing admin support that help with our program. So it's very time intensive, as many of you know, blinding our nominations, getting them. We do put all nominations that we receive in one Word document. They get blinded by patient, unit, and anything that could help you identify who that nurse may be. And it also helps sort of not choose your own unit, so to speak. So we really wanted to make this a robust process for our team members. One thing we did do is we actually vote electronically too. So we have, I think from engaging clinical team members who maybe work different shifts, we have our voting every month open for about a week. And that helps give people who maybe work odd shifts time to read the nominations and vote. We email it. We also put it on a shared team space. So we're really trying hard to help our clinical team members be a part of this, especially with how stretched our healthcare teams are at times. So this group actually has given fantastic insights and helped us streamline, we call it standard of work process, which everybody loves. But we have a process for what does monthly voting look like, especially as we onboard new people to this council. It helps them know what's my job, what's my role. Having it electronic also helps me know who voted and kind of track consistency, if that makes sense. We outlined a tiebreaker process. So what does that look like? The team really wanted to still be a part of the tiebreaker. And we actually just in July had a tie. So we were able to make the tiebreaker process and then put it to good use, which it went really well. We have an admin support standard of work. And we also created this year a leader toolkit or leader celebration. So I'll tell you a little bit more about that, but we really wanted each team member across our fairly large organization to have the same celebration, not the winner necessarily or the honoree, but the nominee. We really wanted to have some standardization across that. So we've enjoyed kind of putting some of those processes into place. So here's a little bit about our nomination form. So we receive nominations many different ways, really. It's on our public website. So if a patient or team member wants to go there, they can fill it out. It actually directly kicks. We have an email that it goes to. We have wall clings that are really all over our hospital. So team members or patients can scan the wall, the QR code there. That also goes straight to our email. We also have paper nomination forms. Really wanted to be inclusive for maybe someone who isn't as familiar with technology. And then new this year, we actually have Spanish. So the form is in English and Spanish. And then we also have a process for if we receive a Spanish nomination, getting it translated so that they have equal opportunity to win. So really excited about that. We have a language access committee at Riley, and we have plans to expand the languages that we have our nominations in, but taking the time to make sure we also have translation standards and supports in place. So really looking forward to expanding our possibilities for nominations. Some of our areas also put the paper forms in their discharge folders because a lot of people under stress maybe can't quite process what the stories they want to tell. So we've found that really helpful as well. And then new this year, the committee or the council added some really clear instructions for how to submit the forms, just to help making sure IU Health, each facility has a different DAISY inbox. So we just wanted to make sure that our Riley team's nominations were coming to us. And then we just recently refreshed all of our wall clings. So that's kind of a little bit about how to nominate. And like I already said, we do accept nominations from patients or team members. One of our winners this summer was from an ED resident about a nurse's care that she gave to one of our patients. And you'll see a picture of her shortly. We do have, like I said, a very clear standard of work for what the nomination process does look like, or the selection process. So all of the nominees, actually it's October 1st. So September, we just sent out to the group today, and then it'll close next Tuesday when our group meets. So we do, based off their feedback, we meet once a month, and we actually allow, similar to some of my colleagues already, we allow agenda time during our meeting so that if nurses have been busy, they have time to vote during that time. We use this voting criteria that you see on the screen. So it uses the IU Health nurse attributes as well as the DAISY award or honoree attributes. And every month we actually put the voting criteria on top so that it's very fresh in people's minds of what we're looking for when we select our honoree. And like I said, we updated our standard of work and to make it really streamlined. So then once we've selected our honoree, we vet through HR after the fact. So we will immediately reach out to the honoree's leader. We do most of our monthly celebrations at the place of where this team member works. And we like to do it on, it's absolutely a secret, we like to do it on one of their schedules shift. So we find out when they're working in the near future. Then we lock it in. We really want our CNO, Megan Isley, to be present. So we work with her schedule and the honoree's schedule. We order balloons and the daisies and the cinnamon rolls, and then kind of start the ball in motion. We have this really cute, I think you'll see it in the next slide, a really cute nurse balloon. It's my favorite. So we usually have things, a lot of times we do our celebrations. Actually, we have one tomorrow at 7. So they're pretty early based off either change of shift. We use the DAISY celebration criteria to help. So we, of course, read about DAISY and use that celebration. And it's really, really special, I think, to have our CNO read the nomination. And she does it. I think we were chatting earlier. She does keep it a secret till the end to kind of help with the surprise. And we have a DAISY banner that comes to every celebration. So it's pretty special. A lot of people are very surprised when they receive the nomination. This is just a few pictures that we have. Here's the ER one I was telling you about. You can kind of see the nurse balloon in both of those pictures. The other one is from our PACU space, which was also very exciting. So we feel really glad that for the most part, each of our month to month, it's not one specific place. It's really well-rounded. And it's, as I was telling you, everything is blinded. So it's really neat to see it kind of, which place are we going to head to next? So we get about 60 to 90 nominations a month, which makes voting actually really hard because there's a lot of fantastic stories that we hear. I just wanted to share kind of our process for all the nominees. So right now we give a pin for every nomination received. I'm looking into the multi-pins. I love that idea. So the nominees who were not selected, we have a special card that is our Nursing Excellence Council created along with the DAISY marketing. And they're signed by our CNO. They'll get a DAISY pin. And then we send them to the leader. And then the leader, we have that toolkit that we created so that each of the team members can have a similar experience. So recommendations in our toolkit are doing a huddle ceremony where they can read the nomination and recognize, putting it in newsletters. And then also new this year, we have a monthly nursing newsletter, and we put all of our nominees each month in the newsletter. So a lot of different ways you can highlight nominees. This is just a little bit about our 2 annual recognition that we do. So we do DAISY team and we also do DAISY leader. We push for those nominations in Q1, and our Nursing Excellence Council votes in about March so we can get the awards going. And this is during our Nurses Week celebration. There's something else I was going to tell you guys about. So this is this year's honorees. The other thing we do, since I was sharing most of our monthly awards or ceremonies are at the unit, we actually also recognize for the previous year, we'll recognize all of our winners. So they're recognized as a hospital as well. And then lastly, just about a year and a half ago, we started working closely with our marketing team And every month they do a story on our Daisy honoree. So this is some recent ones from this year. And my personal favorite, our photographer will come and take a picture. And I don't know about you guys, but a lot of clinical team members or clinical nurses really don't have a really nice picture of themselves. So I love that they have really taken the next step in helping those honorees feel welcomed and special. The other thing, most of these or all of these go on our social media outlets. So it's another way for that honoree to share with her friends and family the honor. And with that, I'm willing to, any questions for anybody?
Thanks, Laura. Yeah, any questions for Laura? Riley is a very awesome, well-known hospital throughout the state, and I know they've got a lot of nurses definitely worth being recognized for. So she'd be a great resource to ask questions to if anyone has them.
Thank you, Bonnie.
Anyone? Maybe not.
That's okay.
Thanks, Laura. Great job.
Thank you.
All right. And then you guys get to have me as your last presenter. So super excited to be sharing with you. I'll share a little bit about Ascension St. Vincent. Can you guys see my screen? Okay. All good? Okay. Awesome. So like I said earlier, my name is Mallory Luby. I'm the Associate Engagement Coordinator for our Ascension St. Vincent Indianapolis campus. We are a large organization through the whole state. So I'll kind of break it down with what I cover here. So I represent our central region, which, like, all that to say is really just our 86th Street campus right here on the north side of Indy. We've got several buildings that are all kind of grouped into our respective Daisy Award program. So we have our main hospital for our adult acute care and all of these yellow bolded numbers are about the number of beds that we have. So lots of patients throughout the whole campus. Obviously our Peyton Manning Children's Hospital, our Women's Hospital, we have a stress center, our Seton Specialty long-term acute care hospital. We have 4 smaller emergency departments throughout the city. And then just to wrap it all into one, we've got about 1,000 beds throughout the community for our region. And then we've got probably just over 2,000 nurses. So a lot of ground to cover with this Daisy Award program. So I'll hopefully explain how to make it look nice and easy. So our Daisy program history, we actually launched this program in March of 2015. Ann Carr was our very first Daisy Award winner. So I had her old managers dig up these photos. And I don't think this is the photo that when she did win on that day, but of one separate from her presentation later on in the future. So lovely Ann right there. She's now retired, well-deserved retirement. But we did start as a 1 per month Daisy Award given. And then we recently transitioned to 2 in 2022. I think this just was a suggestion from the Daisy Foundation with how many nominations that we were getting each month. So we've given 144 Daisy Awards to date since the inception of the program in 2015. But we average about 70 per month. That number is slowly increasing, which is really great, but just adds a lot of nurses to recognize, which we love. And then we've had over 3,500 Daisy nominations to date. And a little bit about how we collect nominations. There's several methods that we find work. We do kind of wrap all of that into our one form. So we have QR codes everywhere. You see this image on the right side of the screen is a flyer that we have posted around campus on our inpatient units and just all over our TVs, things like that. But we also have a couple other methods on how we can collect Daisy nominations as well. So we utilize a software called Get Well. It is a application on our TVs in our patient rooms. And so we have our Daisy nomination form embedded in that software. One cool thing about that is that each room comes with a keyboard, so it can connect with the TV, so patients can type their nominations while laying in bed. We find that that's not the highest way that we receive nominations, but it is a method for some patients. It does work well. We have TVs across campus, just patient-facing, kind of visitor-facing TVs where we'll have this QR code as well. We utilize social media, just adding links wherever we can for people to click and nominate. And I will say that our paper nominations are rare. Very rarely I'll get something in the mail, like a handwritten nomination or nominations given to managers on the inpatient units. But those do come in, just very rare. And one exciting thing, Ascension Health is partnering with Qualtrics. We use Qualtrics for all of our patient surveys. So we are going to soon connect patient surveys with our DAISY form so that nominations can filter in that way. Kind of a new, innovative, creative way to receive more nominations. So we'll see once that becomes piloting throughout the country within our organization. We'll get to pilot that here locally probably in a few months. So excited about that. We do, just because we're so big and we've got so many patients and so many different nurses, we do accept nominations from pretty much anyone. So definitely patients, family and friends of patients, visitors, but also coworkers and leaders and just anyone. I will say the heart of the DAISY Award for us is just that the story is a patient-centered story, or the really kind of exhibiting that nurse-patient relationship. So when we're selecting our winners and voting, that's a big key thing to keep in mind for our committee, which I'll get to. And then all of our nominees are recognized by their direct leader each month. And so you'll see, if you're ever on campus, you'll see so many of our nurses walking around with the DAISY pins on. They get so excited about them because the multi-pin has been a topic of conversation. We do have those here locally. So we have several nurses who really have been nominated so much and have even won a couple times just with their expertise and their awesome just patient relationships. So our voting process, we have about 30 committee members. It's primarily comprised of our Indie Associate Engagement Committee, which does include some non-nursing individuals, but also new as of about last year, maybe a year and a half ago. We invited several of our tenured nurses. So I think we cut it off at 25 to 30 years of experience. Any of these nurses who have been with St. Vincent for that long know our values, know just proper care with patients and going above and beyond. So we invited them to join the committee. Not everybody wanted to, just because, as other people have stated, it's a lot of work with reading several nominations every month. But we did have a really nice chunk of tenured nurses who wanted to join the committee, and I think have so much fun reading them every month. We do have a nomination list and a Google form. So that is how we'll kind of redact the nominations, again, to other people's points here on the call. We take out the names, we take out patient identifiers. If we can, we try to take out any unit identifiers. That gets really tricky with our peds and our baby areas, but we try to redact as much as possible. So we'll send that list with all of the nominations and then a Google form for our committee members to vote every month. All of those nominations, again, are redacted to exclude names, and then our committee members submit their votes. So they simply just vote for their top 3 favorites. And because we do have so many committee members, those kind of tiered votes come in. We found that this is the most efficient way for our team to do it that way, and it keeps things simple for our voters as well. And then we identify 2 nurses after that form closes after the month or a week of voting, and then we take it to our managers to notify for approval. So I did this morning. I simply just asked them if this specific nurse is a good candidate to receive the DAISY Award. Because we do have about 70 plus nominations every month, I don't send that to our HR team to verify. It would just take a while, and in terms of just keeping things timely, we just simply go straight to the manager. So We leave that to them. And once they approve, we of course coordinate schedules with our nurse leaders, our honorees, and then one priority of ours is to really include the nominator if they wish to be present. We of course center the presentation around our chief nursing officer that she can be there. But a huge priority for us is to always invite the nominator. We also have just a lot of awesome leadership teams here who know the family of our nurses and have connections. And so we always encourage leaders to notify somebody from their family, maybe their direct contact. They know their associates best, so we leave it to them. But there are lots of occasions where husbands are coming in, wives are coming in, kids, if it's summer, come in to help celebrate their mom, dad, sibling, cousin, really just whomever. We gather all of the supplies, typical Daisy Award presentations, flowers, cinnamon rolls, build the certificate, have the pin, healer's touch sculpture, and all of that. We display it on the table. You can kind of see in some of these photos. And then during the presentation, we always go to the honorees department so that they're surrounded by their team. And just to keep that element of surprise alive. We really don't want them to find out. There are circumstances where they kind of know, where they do find out a little bit. But we try to keep it a big surprise. Some units prefer to have these presentations at shift change. So right first thing in the morning, like 7 a.m. Or later into the evening if the circumstance matches up. But a lot of times it's kind of just sporadically throughout the day based off of our schedules of our leaders and our associates as well. Our chief nursing officer will read that redacted nomination with a grand reveal at the end, and Laura alluded to this too, but we read the nomination, and anytime that the nurse's name is mentioned, we replace it with Daisy, so that our chief nursing officer, Jill, will say, Daisy did this, or Daisy did that, or Daisy's a great candidate for the Daisy Award because, and then she'll read just the remaining part of that nomination. And then at the very end, we'll say, Sally is like, congratulations, Sally, or we hope you really win this award, or however it's worded in the nomination. So after that, the nurse typically kind of knows as the story is being read that it may be him or her, which is really fun to watch. And we take lots of photos, try to get some candidates, and then open the floor while we have the team together, and just to facilitate that community of positive affirmations and just different words from peers. But they'll typically say, yeah, this nurse, or you do really do a great job of this or that, or just whoever's present, And then after the presentation, we obviously recognize them on the Daisy Foundation website. We blast them on social media, internal outlets throughout the campus, newsletters, things like that. But we re-recognize all of our nurses during Nurses Week. So from the year prior, we'll often just give them like free treats or drinks in the cafeteria for the week or something like that. Just anything that we can do to re-recognize them, and they just show their badge. So really fun. I think I have some images here for you. This is Jill. She's our chief nursing officer, and just some pictures from the last year of different presentations. This nurse on the right is Chris from our PEDS emergency department. We just did this award last week, and the patient and the nominator, his family came. So he was nominated by a 7-year-old, and it was so precious to have them present and leave school early to help recognize this nurse that took care of them. And then for us, I did mention that we try everything in our power to get the nominators connected back with their caregivers. It's just the heart of the Daisy Award for us. So these are just several images of our nurses with their nominators. I would say most times we can get them. There are occasions where they can't come in, or you can see this bottom left image of the laptop on top of a microwave. We had to Google Meet in the nominator because she was home with her 2 freshly graduated NICU babies. So just anything we can do to connect them with their nominator, which is really fun. And some ways that we blast and try to advertise our winners around campus, social media, just some screenshots of things like that. And then we do have some additional DAISY programs. We just started our DAISY Nurse Leader Award a couple years ago. So we've given two. Those are our two winners. Wendy is on the right. She was our very first winner. And when we collected nominations, she was a shoo-in, had about like 50 nominations just from staff that fall underneath her. She's a director, so oversees a ton of people. And then Chris D'Alessandro she is freshly retired after a couple weeks, our DAISY Nurse Leader Award this past May. So we do these. And then, of course, our DAISY Team Award. This was our wound ostomy care team who received the DAISY Award this year. But we've been giving that out just a little bit longer. So we do these annually during Nurses Week. To really amp up the week and give a spotlight to nursing. So there's always a fun anticipation that week of when and who will receive those awards. So that's everything from me. Here's my contact information, and I believe we'll hop into some breakout rooms. So Janet, I think I'll give things back over to you unless anyone has questions, and I'd be happy to answer.
Thank you so much, Mallory. That was a great presentation. Are there any questions for Mallory before we go to the breakout session?
I do have a quick question because we do not have we just started the Nurse Leader Award at our VA. This is Monica again from the VA. Of course, it sounds like I'm the only one asking questions. Anyways, but quick question. When you guys do your team awards, you do those annually. And tell me more about those. How do those work for you guys?
Sure. I can go first. I can't remember who else had team awards on our little presentation committee. Laura. Okay. So for us, all we do is I collect nominations throughout the year who are very obviously for a team. I would say we probably get between 6 and 10 clear nominations for a team. I mean, you know how it is. Sometimes patients will nominate and say like the whole unit or this whole team really had an impact on my care. So that's how we've done it now. I think probably some opportunity to open it to social media or just the community to offer. But that's how we do it now. Laura, do you have anything different?
We use the DAISY Leader criteria. And we do in month 1 a quarter, we call it push. I will agree with Mallory. It's more of an internal nomination. We don't have it an external patient opportunity, but we do use the DAISY criteria for it. 2 years ago, it was mixed in with the monthly, so it was a little hard to delineate. So this year it was a separate Microsoft form. And I had all Nurses Week awards on there. And we got probably 5 times the amount of nominations that way. So I definitely recommend pulling it out of, just for our experience, pulling it out of your monthly or DAISY specific criteria. So that was really helpful. And then we use that criteria to vote when we vote. I don't know if that's helpful, but we do it January through March, and then we vote at the end of March so that we have everything ready by May.
Awesome. Thank you for sharing your feedback. And thank you, Monica, for asking questions. I think everybody learns when people ask questions. So thank you for that. Any other questions before we move on to breakout? Okay, I'm going to share my screen. And at the bottom of your Zoom screen, you should have 4 little, like a window symbol that says breakout room. So you'll want to click on that and choose which breakout room you'd like to be in. And then when it's time to return to the main room, just click the blue bubble to leave the breakout room, and it'll take you back to the main room. Here are your options for the breakout rooms. Number 1 is for large facilities. Number 2 for small facilities. Number 3 for specialty and non-traditional. And then lastly, number 4, the newly committed or first year
launch. When leadership changes or competing priorities take precedent, there can be a number of reasons why your program might need a little bit of a revitalization or to start anew. We talked a lot about annual award frequency as well. For example, with 12 awards per year, certainly monthly kind of is the initial thought for that quantity of awards. But we talked about different options. For example, still recognizing nominees monthly, but scheduling award presentations on a quarterly basis, either grouping them all together or having a Daisy Day where you might go to individual nurses to recognize them with their awards, just to help alleviate some of the complexities of scheduling a Daisy Award presentation. Different schedules, making sure leadership's available, nominators are available, the nurses working, things like that. We also talked about nominee recognition, just in what they get, some doing it in a public way, the opportunity where you can do it on the unit level in a staff meeting or one-on-one or at shift change, and then also inviting nominees to celebrations to recognize them there in more of that public way. We had a lot of good conversations just about those initial ideas, initial plans, and also how that first year of Daisy is an opportunity to see what works. Fundamentally, the program is the same no matter where it's taking place, but how every organization operates, their internal processes are going to be different. So finding what works, what is the best groove for your Daisy team, for your leadership, to make sure that the program can be sustainable and successful long-term.
Wonderful. Thank you very much, Alex, and your team. Rebecca and Kate, do you want to go next?
Yes, we are happy to. We had a small but mighty group. Myself, Kate, Laura, and Jordan were in there. And we had great conversations around how to make a big impact in smaller facilities and specialty settings. And so one of the things we talked about was inviting the Daisy family. So whether it's Bonnie or Melissa or your program manager, director, being there and being present at your presentations virtually. We can't always make it, but please reach out to your main point of contact and we're happy to orchestrate that with you and help talk through how to do that virtual component of it, having us there in a Zoom or a Teams. We also talked about how often to present. You all are welcome to grow your programs. We typically recommend presenting about 2% of your nursing staff. But if you are seeing 75, 80 nominations a month and you're only presenting quarterly, talk with us as your program team. We're happy to help you kind of evaluate and figure out what's the best fit for you all. Our goal is to make sure that your nurses feel honored and recognized. You all, also, the nominator, having them there at your presentations, it really maximizes that emotional impact of your Daisy presentation. And then the family members of your honoree. I know sometimes there's also security restrictions, especially going into cold and flu and COVID surges right now, but that can also be done virtually. It really is emotionally impacting to have the nominee read the story that they wrote for the honoree and ties it all back together. We talked a lot about emphasizing the benefit options for the honoree during the presentation. I know we hand them the insert and they get it with the bag, but talking about the Healing Hands Conference scholarships that are available and the reduced tuition rates, really making them feel and talking it up so they know that this is a big deal. And then the other additional offerings that we have, we can help you all if you want to do a nurse educator and nurse leader award. We can provide an electronic nomination link for those. So you all aren't having to do just those paper nomination forms. And then you can still do them externally as well, like on a Teams form, something of that nature. But then utilizing your QR code. So anything that you link, creating to a QR code in the specialty areas. I had heard recently, and I was talking to the girls there on the call about making a sticker roll of those specialty ones. So you can add stickers to your materials instead of having to reprint everything if you want to add something temporarily. Room refreshes were also a big part of our conversation, just going back through regularly and ensuring that all of your materials looking nice, engaging your committee to do that and help you with that. It can work as a self-check just to make sure that all units are receiving the recognition when you're showcasing all of your nominees as well. So throughout newsletters and things of that nature. So we had some great conversations. Thank you.
Small but mighty group, for sure.
Yes.
Well, thank you so much. London and Vernita, do you want to go next?
Absolutely. So we had a wonderful, wonderful discussion. I'll point out a few things. So how to encourage, committee members and leadership support is essential. We know that sometimes committee members can, fall off or not be as active. So we recommend having call to action for that support to become a part of the DAISY committee. You never know who wants to be a part of it. Put it out to everybody, maybe include it in a newsletter or sending out an email is always very helpful. And then maybe even creating that a recognition committee, starting there. And we know leadership is very, very challenging to kind of get on the same page, get in one room. So schedule the meetings further out if possible to ensure that everybody can make those. And we know also that limited budgets are a issue and sometimes a struggle. So we do recommend utilizing that resource center as well and periodically checking it out. We are continuously making updates to the resource center, rolling out things like Canva and such, and they can definitely be helpful with your program if you are limited and maybe getting banners or things like that and making sure that that recognition is throughout your facility. And then we talked about how much time are you spending on Daisy? How much time is dedicated to Daisy? We know that you guys have your own roles, right? And Daisy is an added thing to that. But we recommend, blocking out some time to dedicate to Daisy. It doesn't have to be a whole lot, but if you do block out that time, maybe weekly to just look at the nominations, check out marketing and things like that, it can definitely be helpful. And also encouraging those nominations. I know that in the live presentation, we heard about how OR is not maybe receiving the amount of nominations that you would like or any at all for that matter. So encouraging those staff nominations and management nominations is a great way. Ensuring that you have included information in the discharge folder as well for patients to look at a later time has also been very helpful with encouraging those nominations. And then a personal favorite of mine is that if there are any nominations that are smaller, you don't want to necessarily judge those against the larger nominations because we know that the smaller nominations are just as meaningful, and we believe that every nomination it should be celebrated. So taking those smaller nominations and grouping them in a group, I guess, and judging them against one another. So if one person said, this nurse is great, she gave me socks, judge it against another one that says this nurse was great, she gave me a blanket. And that way, those smaller nominations can still be recognized with the Daisy Award, and they aren't necessarily in the pot with the larger ones. So we had some very good conversations, and that is pretty much what we came up with. Thank you.
Thank you very much. And last but certainly not least, Chelsea.
Yes, so just touching on kind of what Bernita just ended on, we started our conversation kind of talking about how to expand on short nominations as well. And that was actually a great suggestion, Bernita, to kind of group them together. And what we talked about, because I was in a group with some smaller facilities, so they might only be presenting once a year. And so we talked about, now not everybody might have this bandwidth, but if you have the patient information, you can reach out to them and see if they'd like to expand more on their story. They might not have realized that you want more details. So just, reaching out to them and asking and seeing if they'd like to expand on that story. Also, tap into your hospital volunteers if you have them. They can be a great resource to help with kind of those tasks. Even typing up handwritten nominations, blinding them, reaching out to nominators to see about more information. So those are great things to delegate as well. Something you can also do, which we didn't necessarily talk in our small group, but I just thought about it as we're sitting here chatting, is ask staff as well. Reach out to the nurse manager, see if maybe they'd want to expand. Maybe they know what the situation was with that patient and they can give some background as to what the nurse might have done behind the scenes that the patient might not have known about. Or they might be able to expand and share other stories of care that this nurse has provided as a way to beef up that nomination submission. And then something we also talked about was including staff nominations. So encouraging staff to nominate, especially for maybe some of those units that's hard to get patient nominations from. Doesn't mean there's not great care happening. And so the staff can certainly share nominations and nominate each other when they see great moments of compassionate care occurring. And then also talking about Daisy while rounding can be a great way to encourage more nominations and also get a little bit more substantive nominations. And you can certainly transcribe what the patient is saying right then and there. We all know they might have great things to say about their nurse. You hand them a nomination form, they just kind of tuck it away and never fill it out. Doesn't mean they don't want to share their story. So certainly taking those few moments, writing down what they're saying, asking them, would you like us to share this with our recognition program? The patient's likely going to say yes because they're sitting there gloating about their nurse, and that can just be handed right over to you as a DAISY nomination. So just ways to kind of get more substantive nominations and encourage more nominations in general. And I know we're getting close to time. So
Yes, terrific. Thank you. And thank you to all of our moderators for all of your discussion and feedback. This is very helpful. I hope that you all learned a few things today that you didn't know before that will help you to grow your program and ensure even more program success. I have to say, of all of the states that I've worked with, Indiana is one of my stars. You guys really know how to do DAISY well, and it's been an honor for me. I've had you as part of my region since day one with DAISY, so it's been really great getting to know all of you. Are there any questions before we kind of wrap up today? Okay, well, I certainly thank you for taking the time to be with us today, and keep an eye out for that email with the recording and the follow-up resources. And of course, always reach out to me if you have any questions. We're here to help.
Thanks, Janet. This was very helpful.
Thanks, everybody.
Thank you. Have a great
Thank you.
rest of the day.
Thank you.
Thanks so much.